Well, hello, my name's Jesse Jokerst. It's unfortunate that I couldn't be there to present this to you in person, but I'm hoping that this will communicate some of the ideas that Darren Lapomi and I have about building a flexible sensor, essentially a flexible bed sheet to monitor pressure ulcers. So I want to walk you through a few things. First, the problem that we're discussing. So currently 12 million people in the United States are in long-term care, so some kind of nursing home where they're essentially immobile. And so 12 million per year in the USA. This is projected to be 27 million people by 2050. These people suffer from a variety of diseases that I'm sure you can imagine, but one of the most common is pressure ulcers, also known as bed sores, also known as a decube ulcer. So this is a source of infection. This can even lead to amputations. They're very difficult to treat, very difficult to heal. These are sick people to begin with, and when they get these bed sores, it makes the already problematic situation of long-term care even worse. Right now, pressure ulcers cost about $10 billion per year to treat. So we could imagine that a product that could help long-term care facilities minimize the rate at which their patients experience these bed sores could be very beneficial. So some of the most common sites of pressure ulcers are on the heel, the buttocks, the shoulders, the back of the head. These are areas that are in long-term pressure and immobile pressure with the bed. Okay, and so they originally look like these kinds of sores. Again, they're difficult to treat. Prevention generally, unfortunately, has remained the same for about 150 years, and it involves rotating the patient regularly. The addition of these kind of foam mattresses, these egg crate style mattresses can help, but any situation where there's this long-term pressure can eventually lead to bed sores. So as the stage progresses, these bed sores are characterized by the depth at which they are into the tissue. So at a stage 4, a very advanced pressure ulcer, this is reached all the way down to the bone. In a stage 1 ulcer, we're essentially only limited to the epidermis. So stage 2, 3, and 4 are very easily detected by eye. What we propose is to create a device that could detect these very early stage pressure ulcers before they have advanced, and this would allow them to be much more easily treated through, again, turning the patient. So what this device would do, if we had this smart bed sheet that could tell the long-term care facility who was getting bed sores and where they were getting bed sores, they would know when, not only when to turn the subject, but also when not to turn. Earlier identification of these lesions then would lead to lower cost to the facility because they would have fewer personnel needs, fewer treatment needs, and better outcomes, especially in the age of the Affordable Care Act, and outcome-based reimbursement is particularly important. So the technique that we've proposed to use is known as photoacoustic imaging. So briefly, photoacoustic imaging is like ultrasound. In ultrasound, we have a transducer that emits and receives sound waves. In photoacoustics, we use both light and sound. So there's incident optical excitation onto the sample or the tissue. When that sample or tissue absorbs the radiation, it briefly heats and experiences thermal expansion. And this thermal expansion creates a pressure wave that we can detect acoustically. So this has been originally described by Alexander Graham Bell over 100 years ago, but it hasn't been until the last 10, 15 years that the transducers have been sensitive enough and the lasers have been fast enough. We're using nanosecond light pulses that we can use this then to create acoustic imaging. So it combines the temporal and spatial resolution of ultrasound, about 5 hertz temporal resolution, 100 micron spatial resolution, with the contrast and spectral nature of optics. So what's neat, by spectral nature of optics, I mean we can start to have red, green, and blue ultrasound. We can excite at 650, 750, 850 nanometers and have different kinds of ultrasound. Again, we can also use our diffuse photons. So unlike optical imaging, these diffuse photons are not very useful, but in photoacoustic, when our target absorbs the photons, it heats, it swells, and then we can create that to do imaging. One of the great features of this technique is that we can use it to image endogenous absorbers. So what absorbs light in tissue? Well, it turns out that hemoglobin and deoxyhemoglobin are very good absorbers, but they have different absorption spectra. So this is, I'm sorry, this is going to be small. This is from 700 to 900 right here. And deoxyhemoglobin is red. Oxygenated hemoglobin is this green curve. And so what we can do is start to do ratiometric imaging at two different wavelengths to understand not only how much hemoglobin is in the tissue, but what concentration is oxygenated. And this is a kind of a classic example from the literature where people have mapped this and then using differential absorption could plot out what's the venial and what's the arterial in this tissue. We've also done similar work in my lab where we look at different pressures in the eye of, this is a rabbit model, and as the rabbit breathes different amounts of oxygen, you can see the oxygenation in the retina changes dramatically. So this is the concept that we propose to use to monitor bed sores. So we could essentially have this, this device that's monitoring the dysregulated oxygenation that is going to be occurring in the epidermis. So Darren Lapomi, again, who I think is in the room right now running this meeting, will be the collaborator here, the lead collaborator, and is a world expert on creating these tribok polymers, these semiconducting polymers that can not only provide a strong scaffold and support the organic LEDs, but also emit light in the near infrared that we're going to use as an excitation source. So I'm going to turn this slide over to Darren. At the end, I'm sure he's going to come back and offer more details. The work plan we propose is going to use an existing animal model that we already have in the lab. We're essentially pinching the animal's skin with these tiny magnets, and that pinching modulates, modulates the blood flow and then creates a pressure ulcer model. We're going to image this with a gold standard transducer and monitor different stages of pressure ulcer in this animal model. We're then going to transition to flexible excitation and use a gold standard transducer. So rather than having a transducer in AIM-1 that does both excitation with light and acoustic detection, here we're going to excite with light with the flexible device from Darren's lab and then detect with a gold standard transducer. The third aim then, which is beyond the scope of this pilot study, would be to have this flexible device that incorporates both optical excitation and acoustic detection, perhaps with collaboration through other members of the center. So I think the deliverable here again is this flexible excitation tool that we will show can be used with a real established model of pressure ulcers. Beyond thinking about pressure ulcers, this kind of flexible excitation has a dramatic could have a dramatic impact on the practice of medicine when you think about other superficial areas that have dysregulated vasculature, arthritis, peripheral artery disease. All of these could be very easily characterized by this kind of device. And then beyond this pilot project, the next step would probably be an R01 proposal to the Institute of the NIH, NIGMS, General Medicine for further construction of this tool and validation with other models. So I appreciate your consideration and again, apologize for not being able to attend in person. Thank you.